Hi, I'm Jessica McMurdy from playitforwardtherapy.net. I'm also the clinical director and owner at Stepping Stones Therapy Network in Bellevue and Bothell, Washington. I've been an OT for over 2 decades, and I'm excited to share with you some things to know when it comes to preschool development. I'm excited to share with you this occupational therapy preschool screening checklist. First of all, how are things going with your 3, 4, or 5-year-old at home? How are things going at school? We're going to talk about occupational therapy and the role that we can help when it comes to preschoolers getting ready for kindergarten. Occupational therapists help preschoolers get ready for kindergarten by helping them build really important fine motor, sensory processing, and social skills that are necessary to succeed in school. Now, many parents worry about their child appearing different or standing out. However, if foundational kindergarten readiness skills are not addressed early on, kids may end up struggling more later on, and their problems will become even more noticeable. Well, the best pediatric practitioners know how to make occupational therapy sessions fun because all of the work happens through play. Now, the primary goal of occupational therapy is to find ways to help your child be more successful. So if you think there's a problem, my advice to you is to follow your gut and don't wait. Early intervention is absolutely essential to give your child the tools that he or she needs for school readiness to learn and to play with confidence. When it comes to knowing what's typical and if your child is on track, there are definitely benchmarks, which we call developmental milestones, that between certain age ranges, kids should be able to achieve. Now, sometimes they might be really strong in one area, but have some lagging skills in another area. The checklist I'm going to share with you is a really general yet well-rounded checklist that it represents the most common issues that arise in preschool age children. Occupational therapy looks at the whole child. Therefore, you'll notice several areas to be on the lookout for, such as gross motor skills, running, jumping, navigating play equipment, so all the big muscles, and fine motor skills, so dexterity, being able to color, cut, write, and draw. We also take a look at emotional control and self-regulation and sensory processing challenges, such as being overly sensitive or sometimes on the other end being unaware of certain sensory inputs. If you find that your child is experiencing a few of the challenges outlined in the checklist at home or preschool, then it's really important to have your child assessed and bring up your concerns with your child's primary care provider or pediatrician. This is especially important to prevent any further delays in development, and if your child tends to avoid certain activities, or especially if they lack confidence or are really having trouble participating in what other kids are able to do. You want to keep in mind that doctors are typically screening for whether your child is medically healthy when they do their medical checkups. Developmental skills such as attention, behavior, motor coordination, sensory processing, and play skills are sometimes overlooked, or there's not enough time to be able to really assess all of those. So be sure to bring up your concerns with your doctor if you're noticing challenges at home or if your teacher has concerns as well. Children can be perfectly healthy yet not be on track developmentally, so if someone tells you to wait or the kids will grow out of it, this is not always the case. The infant through preschool years are considered a sensitive period or a critical period in a child's early development. The neurological foundations for learning are being set up during this time. So when in doubt, I encourage you to check it out and to pursue further evaluation if needed. And remember, as a parent, follow your gut. Even if others don't agree with you, you know your child best. It's really important to be your child's best advocate if your child needs a developmental boost. And sometimes that's all kids need, is an intervention to get them started in the right direction. This checklist will help you answer the question, how do I know if my preschooler needs occupational therapy? The first thing is, if you've noticed your child says, I can't or I won't to age-appropriate activities. Does your child need more practice than other children to learn new skills? Are they clumsy? Do they fall frequently? Do they have what we call low muscle tone? Or do they seem weak or floppy or have low endurance? Does your child bump into furniture or people? Do they have any trouble judging their body in relation to the space around them? Do they really dislike coloring in the lines or doing puzzles or cutting with scissors? Do they avoid any of these fine motor activities? Is your child overly active? Do they have trouble slowing down or calming down? How about attention span? Do they have a short attention span? Do they move really rapidly from one activity to the next? A good general rule of thumb is you think 3 to 5 minutes of attention for every year of age. So if your child is 3, you would expect them to be able to attend to something for at least 9 to 15 minutes. Now, we're not talking about video or electronics, we're talking about general activities in their routines. Does your child have any delayed language development? Do you have trouble understanding them? Do they seem like they have trouble following directions, or maybe they appear like they don't seem to hear you? Have you noticed any challenges with difficulty being able to self-calm or tantrums that just go on and on? Have you ever noticed that your child doesn't notice, or they might overreact to touch, taste, sounds, or smells? When it comes to self-care, do they really dislike bathing, nail cutting, hair brushing, or brushing their teeth? And when it comes to eating, are they a really picky eater? In other words, do they eliminate eating whole entire food groups where it's starting to impact their growth and nutrition? Does your child have any difficulty handling unexpected changes or changes in routines, or difficulty transitioning from one activity to the next? Have you noticed any challenges with following directions, especially 1 to 2 step directions? When you're out and about on the playground, does your child avoid playground activities? Do they prefer sedentary play in terms of not moving around a lot? Do they not enjoy jumping? Do they avoid swings, or do they feel really scared when their feet are off the ground? Does your child ever find it difficult to make friends with children of the same age? Do they prefer to play with adults or younger kids rather than same-age peers? Is your child ever easily frustrated, or do they lack confidence to try new things? So all of these are things just to be on the lookout for. I hope that you found this checklist helpful for bringing up any areas of concern. So whether you use it for discussion with your pediatrician or teacher or therapist, you'll find it to be a really helpful resource to get the conversation started and hopefully to get the developmental boost that your child needs to take them to the next level and help them reach their potential. So if you're a parent and ready for the next step, I encourage you to contact your homeschool, ask your pediatrician for local referrals, or if you're in Washington State, you can come visit us at our clinic, Stepping Stones Therapy Network in Bellevue and Bothell, Washington.